Hello everyone and welcome back to the channel. In today's video, I'll be going over my first rapid response as a resident physician. And I'll be going over the case and talking a little bit more about what happened during the case and also some additional teaching after that. Hello, this is Dr. Denibo, internal medicine. Yeah. 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 Oh, okay. Okay. Yeah. I'll be there in a second. Yeah, I'll be there right away. I'm heading there right now. Okay. Okay, thank you. Just try to put the patient on their side and call for a rapid response. Yeah, I'll be there right away. Okay. All right, bye. Okay, so just coming back from what we call a rapid response. I was called because the patient was having a seizure and we had to run into the room and practically just make sure everything was okay and respond. But now heading back to the floor to deal with the rest of the stuff. So just got back from that rapid response. Practically, this is a patient that has needed a lot of hemodialysis, but hemodialysis was on hold for the past couple of days because their catheter wasn't working. So we actually needed to place a different catheter, something called a tunnel dialysis catheter. And the patient, the nursing team called me saying that the patient was not responding as well as usual, and then they noticed the eyes flickering and they were worried about the seizure. So when I got to bedside, the patient was truly having a seizure. Placed them on their side, got some medication, a medication called Keppra, and also we called the rapid response. Rapid response just practically means a bunch of advanced trained both physicians, respiratory therapists, sometimes pharmacy. It's not quite a code, but it's close to a code. They come and they help you to assess the situation immediately. The patient was still hemodynamically stable, so there was no need to call a code. We were able to stabilize her, and my thinking right now is that seizure is probably secondary from the kidney failure. The fact that she hasn't had dialysis in a couple of days now. So we sent for some labs and we'll probably be sending her we'll definitely be sending her for dialysis right away, but we'll be waiting for our renal team to get back to us on their recommendations. But right now the patient is stable and I just had a new admission that I have to take care of. Let's talk a little bit more about seizure. This is actually very important because the first time I actually had a case of one of those moments of, is anybody here a doctor? Is there a doctor on the flight? I wasn't on the flight, but I was at a coffee shop in Michigan and I was studying. This was a medical school and someone all of a sudden started seizing and they rapidly asked, is anyone in medicine? Is there anyone that knows what to do? And with my background of nursing and being in medical school, I stepped up. Witnessing someone experiencing a seizure can be an extremely frightening moment, but knowing what to do can be even more important and life-saving. Seizures are sudden, uncontrolled electrical disturbances in the brain, from sudden loss of consciousness to rapid convulsions to sudden changes in behavior or sensation. So like I said, a seizure typically occurs when there's a sudden surge of electrical activity in the brain. And this electrical disturbance in the brain can lead to a variety of ways of presentation of seizures. But I'll be classifying seizures into two main groups: generalized seizure versus focal seizure. So generalized seizure typically occurs when both hemispheres of the brain are affected. That's why it's named generalized seizure, because it's affecting the entire brain. So both hemispheres of the brain is divided into two hemispheres. And if both of them are affected, then that's generalized seizures. This typically leads to loss of consciousness. And examples include like the tonic-clonic seizure, which is the generalized shaking seizure that we see. Other examples include like atonic seizure, which is a seizure when the individual actually has the opposite of generalized tonic seizure. And then another example is absence seizure, which is typically seen in children, but it's mostly when the individual is just quiet, silent, looks like they've lost attention in what you're telling them. And it's almost like they're absent. Thus the name absence or absence. It depends on if you're French. I don't know why I'm saying that with a French accent. Absence. Absence seizure. And then for focal seizures, so this is when the seizure only affects one part of the brain rather than the entire brain. And it can result in either loss of consciousness or without a loss of consciousness. So with focal seizures, there are two main subtypes. It could be simple partial seizure, which is when it doesn't result in a loss of consciousness. And there's also complex partial seizures. This is when it results in a loss of consciousness. So what really is the cause of seizure? There are many things that could cause seizure. It could be drugs. It could be metabolic, which is a disturbance in electrolytes in your system, or low glucose, which is termed hypoglycemia in medicine, or it could be due to kidney malfunctions. It could also be caused by trauma to the brain. In children, seizures could also be caused by very high fevers. So there are various causes of seizures, and it's always important to try and identify the cause of the seizure so you can appropriately treat it. In the video that you just watched, the cause of the seizure in that aspect we believed was due to kidney malfunction in the patient. And the patient became what we call uremic, which is when the kidneys just aren't functioning as well, and there are a lot of toxins in the body. And if those toxins ultimately make their way up to the brain, they could impact the brain function and result in that seizure. And then of course you have other things that could also result in seizures, things like meningitis, things like tumors, things like strokes. These are a lot more acute and a lot more medically urgent. So typically the way I approach seizures, and be it an emergent case or on the street, is one, I try to stay calm. Staying calm also kind of like passes a sense of calm to everyone else, because it's a high stressful situation. If everyone else is freaking out and if everyone else is under a lot of stress, then things can be a little bit chaotic. So it's always important to stay calm. You gently lower the individual to the floor if they're not yet to the floor, or if they're standing, to prevent them hitting their head. And from that, you want to take precautions in cushioning the head and protecting the head. And then after that, you want to protect the airway. So most times it's advised to turn the patient to the side, and that way you prevent them from aspirating. As all of this is going on, also trying to delegate individuals to certain tasks. So pointing to specifically one person to make a call to 911, or if you're already in the hospital, to call a rapid response. You alone can't do everything, you need additional help. Then the next thing I also try to do is try to loosen any tight clothing they might have, and also try to start a timer to know how long the seizure has been going on, because these are all going to be very important in regards to future management and also the course of treatment. And then stay with the individual and continue to monitor the individual till any additional medical help comes for additional medical evaluation. So with that said, seizure really is something that's very complex, and also something that can be very stress evoking, because you're watching an individual lose consciousness, or you're watching an individual go through something that is just extremely scary. And it's very important to stay calm, call for additional help. Remember to also protect the individual's head as all of this is going on, and also time how long the seizure has been going. So yeah, so that was my first rapid response case as a resident physician. I mostly just observed my senior as they worked through the case, and also just observed and learned the kind of things to assess for in a time of an emergency like that. And yeah, I'm sure there'll be many more rapid responses to come in the future, but leave any comments below if you guys have any additional thoughts, or if you'd like to see more of these kind of content. And also, if you haven't yet, please hit that subscribe button, and also check out other additional videos. All right, thank you for watching. Catch you all on the next one. Bye.